today's news from Novo Nordisk is not about obesity. It's about a drug, semaglutide, in a pill form that they've tested in Alzheimer's disease. And the theory was, and there was some evidence that people who were taking the very first version of the GLP-1 drug, so Victoza or liraglutide, they had a lower risk of developing Alzheimer's when you looked at historic or retrospective data. And there's animal models, etc. So they thought, well, it's worth a try. And it didn't work out. They said that they're seeing some impacts in some biomarkers, etc. And we'll find out next week what biomarkers, but the trial didn't work out. And the question here is, was the theory wrong, or is the drug not good enough? Is the pill enough? And we know the pill doesn't do as well in obesity as the injection. Should they have tested the injection?
That's a good question. And you mentioned that the ingredient here that we're paying attention to is semaglutide, which I hope I'm pronouncing correctly there. Does that mean that this ingredient and Alzheimer's are just a no-go from here on out, or does there need to be more testing before we can determine that?
Yeah, there needs to be more testing, but who's going to do that? I mean, having failed now, who's going to put the money in to test it? Now, Lilly does have an Alzheimer's business in a completely different, with a different set of drugs. And they have a more punchy product once weekly with a relatively easily administered pen. That would be interesting to see whether that helps. And, you know, sort of you get much more drug in the body, or maybe you redesign it a bit. So it really does depend on how much appetite for risk these companies have. And Lilly now, with a literally just over $1 trillion market cap, maybe they should give it a go. You know, it would be magic if this thing, it literally would be magic if this thing just helped so many different diseases.
Sam, talk to us about just the market for dementia. Alzheimer's is one part of it. I would think that's A, it's a big market, and B, it's got to be a growing market with people living longer. How do you guys think about it, and how do you play it if you're an investor?
Yeah, it is a significant societal issue, number one. And, you know, I think there are not many families who would say that they haven't experienced it if they have older people in their extended family. So the market has humongous potential, but you need drugs that actually treat the disease. Remember, by the time you have Alzheimer's, i.e., a full-blown dementia of the Alzheimer type or other types, it's a bit late. That means there's a lot that's already happened. So you need to go early. And early means long, expensive trials. And Lilly is doing that with their assets. So fingers crossed, we'll find out in the next 2 or 3 years where they're going early with these assets. Roche is doing it too. It would be a beneficial.
Right. I mean, the tests with the pill form of Ozempic was definitely a lottery ticket. If it worked, great. If not, we're back to the drawing board.
Exactly.
Are there any effective treatments right now against dementia or Alzheimer's?
Well, by effective, I mean, it's tough to say, but there are drugs that lower this thing that is viewed as a critical part of the Alzheimer's disease, which is amyloid plaques in your brain. They do lower it. Lilly's got that drug. Biogen's got an equivalent drug. Roche is trying a similar approach. And you do slow down the degeneration. You don't stop it, you slow it down. So what we really want is to stop people getting to that degeneration. Try and get them before they have full-blown Alzheimer's or dementia, so that's called mild cognitive impairment. Try and slow that down to give them another 10, 12, 20 years of dignified life.
So where do you think we are on a time frame for something like that, Sam? Is that measured in a couple of years or more than that?
Well, so Lilly is literally trying that, and we'll find out whether, and they have the better drug in this space. So we'll find out whether in the next 2 or 3 years. Remember, these things are trials that need to be run until you start seeing a difference. They get that to that point, and of course, then society has to decide, well, how are we going to pay for this? How many people? Because there's a large market, right? How many people are we going to want to treat with the prices of these drugs, whatever they are, even if it's $10,000 a year, right? And they are on their way to becoming worse, and we want to slow that down. You have 10 million people. I mean, this could be similar in terms of value to the obesity market, but you need the drug to do that. So let's wait and see. And Roche has got a new way of trying to do it, and they're going to go again also into phase 3 to test that out.